Hello, my name is Tracie Smith, and this is the March 19th Daily Situation Report for Thunder Bay Regional Health Sciences Center's response to COVID-19. I am here with Dr. Stewart Kennedy, who is Incident Manager. I want to thank the folks who have identified that we are not practicing proper social distancing. You're absolutely right. I want to assure everyone that both Dr. Kennedy and I are screened every day. We know that we're safe. And so really appreciate people's diligence in that. We absolutely need to be pointing out proper behaviors right now. So thank you for that. The assessment center, Dr. Kennedy, how are things going at the COVID-19 assessment center?
So first off, Tracie, thank you. And I want to assure the hospital and the citizens of Thunder Bay that there's still no positive COVID-19 swabs returned to us. We still have some being tested, as well as some being in the queue for getting return results, but there's been no cases here in Thunder Bay at this point in time. The assessment center is going better than we could expect. I think all partners are cooperating, from the telehealth, from Thunder Bay Health Unit, as well as the assessment center and the professionalism with the nurses at the assessment center. So as long as individuals are still calling the health unit, calling telehealth, if they have a screen and they're told to come to the assessment unit, they are being seen in a timely fashion with appointments. And I think yesterday we saw 28 people, and because they came and they're appropriately screened, we had 25 swabs. So this really able to enhance the service we're providing in a timely fashion. Swabs are the test, and they've been taken anywhere from 2 to 7 days to be returned from our lab in Winnipeg. The reason for the length of time is based on priority. The labs are getting overwhelmed by swabs. Christine Elliott, our Minister of Health, also has announced that she is going to expand the service in Ontario. And I think they just opened up 6 new sites in Ontario that will be open for operation very soon, if not today. And we at Thunder Regional Hospital are also looking at doing in-house testing. We've just ordered the hardware and the software that's required to do this here in Thunder Bay, and we're hoping to have something sometime in April, depending on transportation, testing, quality control, but we're working toward that goal to do in-house COVID-19 testing in Thunder Bay at Thunder Bay Regional Hospital.
And what will that mean for test results?
Oh, I think, again, depending on the volume and how much disease is going to be in the community, we could have turnaround times in 24 hours.
Fantastic. Now, what about elective and elective surgeries, and non-essential services? We mentioned yesterday that we were going to start ramping those down. Can you give us an update?
This is certainly a difficult area to explain to the public because everybody has the definition of elective and non-essential. They interpret it differently. So what we have to do is have our professional staff to also have our nurses and with the assistance of the administrative assistants at physicians' offices, decide what is urgent and what is non-urgent. I want to assure the public that essential care, if you come into the hospital, if you're sort of directed to the hospital by your physicians, essential care is still taking place. We are still doing emergency 24/7. We are still doing life and limb surgery. We are still doing cancer surgeries that require, timely access to the operating room. We are not slowing down those type of services, but some services like routine gallbladders, if there is a routine gallbladder, sometimes services like tonsillectomies, sometimes knee replacements, although they're required, there can be some delay. And we don't know how long this is going to go on for, but we're going to try to actually get things ramped up again. But then, as soon as we find out how this virus is affecting Thunder Bay and northwestern Ontario, we know there's a lot of pain and suffering out there, and even though the elective surgery needs to be done, we have to look at priorities, and some can be delayed and some cannot be delayed delay. And that's a decision with the hospital, but also the provider, the surgeon who has the patient list also knows who will actually need the surgery in a timely fashion and who does not.
Okay, thank you. And I know too that many of our programs and services are looking at alternative ways to provide support to patients through online resources, things like that. So more information will come. If people are impacted by the reduction of services or an elective surgery being canceled, what happens?
First off, I'd let people know that the reason for the elective service being canceled is we need all hands on deck. We have at our disposal in hospital 389 beds available. If and when or if this COVID virus comes into Thunder Bay, we need to have bed availability to make sure we deal with the sick who really require hospitalization. So we can't have elective surgery also being contaminated by any viruses in the same room. So it's for the betterment of the patient not to be having elective surgery if this virus enters the Thunder Bay Regional Hospital and we get overwhelmed. So we need excess capacity. So we're hoping to actually have another 100 beds by not having elective surgery access once this here virus hits Thunder Bay Regional Hospital, and if it hits Thunder Bay Regional Hospital. So we need that capacity to make sure we're taking care of your needs, but also when you come into the hospital, you're safe and you're not get any infection like COVID-19 while in hospital. So it's better for the ongoing health of the patient to suffer, unfortunately, a little bit now, so we actually protect them as time goes on over the next 3 to 4 weeks.
Yeah. And it certainly protects healthcare providers as well.
Oh, absolutely, and both a valued sort of piece of information we discuss every day.
Incredibly important. And so just to reiterate, what will happen if people are impacted, they will receive a phone call from their physician or the hospital.
Yes, if you have any impending surgery over the next 2 to 4 weeks, and that's the time frame we're looking at for right now. It may go on longer. I don't think it's going to be any shorter. You will get a phone call from the physician's offices or the hospital itself where the department's being affected to let you know what to do. But I think at this point in time, all elective surgery and non-essential services are winding down Friday, which is tomorrow, at 15:30 hours. There will be some confusion out there, but you certainly are, please connect with your doctor who's arranged the surgery and their offices, and they can give you better direction at that time.
Okay. And if you hear nothing, assume that you're not impacted at this time. Anything you'd like to add?
No, I'm really, again, proud of the whole team. I think we're making good progress with this initiative. And again, 0 cases right now. So we're meeting our stretch goal, which is important, and hopefully that stretch goal will be in 2 more weeks. We'll be saying the same thing, but that's why we're taking the precautions.
Thank you for your leadership.
Okay. Thank you, Tracy.
Anytime. So I would encourage people to subscribe to the Thunder Bay Regional Health Sciences Center's YouTube channel so that you can receive these daily updates and see previous ones. Also follow us on social media. We're on Facebook, Twitter, Instagram, LinkedIn, and you will find additional updates there. Thank you.
Thank you.